So, hello everyone, welcome to my channel. I'm bringing to you a very interesting video with someone very important to me. He's a consultant obstetrician and gynecologist. Um, the other cap he wears is that of a fertility expert. Ladies and gentlemen, let me present to you Dr. Bukunmi Kolade. All right, so a lot of questions basically about mammectomy, myoma, fibroid. Okay, so it's basically going to be about fibroids now. And because that is tough, so it's going to give us a lot of information about this things. All right, so I'll see you soon. I'm starting a conversation with Dr. Kolade now. I already mentioned that he's a fertility expert. So he's a consultant gynecologist also. He wears hats. All right, so we're going to get plenty things from him now about fibroids. Dr. Kolade, how are you doing, sir?
I'm good. It's nice to see you again, my brother.
Yeah. All right. So that's okay. What is fibroid?
Well, thank you very much. Fibroids are their masses or their tumors or their swellings that grow in the womb of women in reproductive age. Usually, a woman that has started seeing her period to up to the time she stops seeing her period, that's what we call reproductive age. It is in that category of women that fibroids develops in their womb. And we know that people ask what causes fibroids. What we know is that it's genetic, especially we that have dark skins, we that are considered Negroes. So it's very common in people with dark skins. That much we know. And then you tend to see that if a mother has it, there's a tendency that her daughter will have, or her nieces will have, or her cousin will have. So it tends to be genetic, and our dark skin has been linked to the occurrence of fibroids. Let me also say that up to 70% of women in this part of the world have fibroids. But for some, it will be small, for some, it will be big. For some, they may never know because they don't have symptoms. For some, symptoms is always a problem, you know. So it has so many different, but most people that have fibroids really don't even know they have fibroids because there are no symptoms. There are different types of fibroids depending on where the fibroid is located in the womb. Now, the womb has 3 layers. There's an inner lining. That lining gets shed every month, and that's where the menstrual flow comes from. And so we have fibroids there are considered submucosal fibroids. So someone that has a fibroid in the submucosal layer, they tend to have heavy menstrual flows. Then apart from that lining, which had the middle layer, fibroids can also be there. We have this as intramural fibroids. Okay, usually this will not cause any symptoms. Then we have some that are outside the uterus. Actually, we call this subserosal fibroids. So fibroids are classified based on the location. It can be submucosal, it can be intramural, it can be subserosal.
When can it start in actually a female?
Well, every woman in reproductive age group is at risk of having fibroids. So once a woman has reached puberty and has started ovulating, has started menstruating, she can. I remember my best friend in medical school, she was 18 and she had fibroids at 18. Okay, so people can have it as early as that. People can also have it later in life. That's because the drugs, the chemicals in the body that we refer to as hormones that make a girl to be a woman, those are the ones that support the growth of fibroids. So it also makes sense that by the time that these chemicals or hormones are subsiding in the body, what we call the menopause, by the time menopause sets in, fibroids cannot grow any further and they actually tend to begin to shrink. Over a period of time, if it is not fed, it will start to shrink actually.
Okay.
Yes, once menopause is reached.
So, okay, that's just, how can a female tell that she's got fibroids?
Well,
because I know that many times females don't even know.
Exactly. That's
So
true.
maybe they could just go on, they feel it's just small pain and they carry on like that, use paracetamol, you know, they, they, they get some semblance of normalcy.
Yeah, that's very true. Truth of the matter is that most that have fibroids don't even know, because most fibroids don't have symptoms. But the common symptoms that we have heavy menstrual flow. It's a common symptom. Then painful menstrual flow. It's a common symptom. Then some people just notice progressive abdominal swelling. And then it can be embarrassing for some people, because people suggest, oh, madam, are you pregnant? Or they call them ERBG, those kind of things. And for someone that is a young woman that is not married, that is not maybe sexually active, and when you call her ERBG, it's a little bit embarrassing for such people. So those are the common symptoms: heavy menstrual flow, painful menstrual flow. For some people, painful intercourse. People have get to ask me this question many times. Infertility. Fibroids rarely cause difficulty in getting pregnant. I say that one more time. Fibroids rarely cause difficulty in getting pregnant. Usually I tell my clients, I'll look at all the other factors before I consider fibroids as a cause of the infertility. If fibroids are symptomatic, heavy menstrual flow, painful menstrual flow, painful intercourse, they should be removed, certainly. Certainly. If someone is finding difficulty in getting pregnant, we have to put this in proper perspective, because we also shouldn't tell the patient that once I take out the fibroid, you get pregnant, because the fibroid may not be the problem. We should look at other factors involved in fertility before we say, a number of times I've had fibroids removed and patient got pregnant, yes. But that is not to say removal of fibroids is a treatment for infertility. That's just the point I want our people to understand.
Okay. So whenever you have patients and you're suspecting they may actually have fibroid, what do you do for them? Basically, what are the investigations that they run?
Okay, well, several things can present as fibroids, but by the time we do, especially an ultrasound scan, which is a way to image the womb and see what is there, that will guide us a lot. Some people use some form of more advanced technologies, a CT scan and MRI, but for most people, an ultrasound scan will help. And then in investigating them further, we want to know the blood level, because if the person has been bleeding heavily over a period of time, blood level is likely to be low. Want to know the blood level, want to know the kidney function, we want to know how to check the X-ray, as it means also to prepare them for whatever form of treatment they're going to have for the fibroids.
So fibroids can actually affect fertility?
Yes, maybe a small percentage of people.
Yeah. A small percentage, okay. And then a woman can still get pregnant even with presence of fibroid?
That's right.
Okay, that's right. Is there a cure for fibroid?
Cure. Okay, talking about a cure, as I said earlier, it is the hormones released every month by a woman for her ovulating and menstruating that fits fibroids. So as long as those hormones are released, and as long as she has a womb, she can have a fibroid. Ultimately, the cure for fibroid will be to remove the womb. So that yes, the hormones are being released, but there's nowhere for them to work to treat the fibroids.
So we are Africans.
Okay.
We don't remove. I remember one of my the consultants at my office. She talked about the fact that when she was in the UK, and then they had patients basically. Anyway, the whites are like, oh, there was another patient, and like, oh, you got fibroids, you gotta yank it off. Yank it off. Like, but we here we do fibroid surgeries almost on a daily in Nigeria. So we basically know what it entails.
So talking about treatment of fibroids, generally speaking, there are two types of treatments. So we have surgical treatments, in which you have surgery to treat it. Number two, you have what we call medical treatments. For the surgical treatment, there are different types. So for someone that has completed her family and is no longer interested in childbearing, she may actually have the womb removed, which we will call a hysterectomy, which is permanent. Unfortunately, if this person wants to have a child in 2 years down the line, it will not be possible. However, for younger people that have not completed their family, have not even started raising the family, what we advise is for them to remove the fibroids. They remove the fibroids and then they leave the womb behind. Then, apart from that, so this can be done as open surgeries. Apart from that, we have some minimally invasive things that can also be done. So we have something called uterine artery ligation, in which the blood supply feeding the fibroids feeding the uterus is actually blocked. And then because minimal blood goes to the uterus, then the fibroids begin to shrink. So that can happen. All of those things that has to do with ligation, all of this can also happen. They're categorized under surgical interventions. They have medical interventions in which someone may use an injection to stop the growth of fibroids or to suspend the hormones that feed the fibroids or to stop a menstrual flow. But let me also say that medical interventions generally is not advisable for someone that is trying to get pregnant, because the same drugs we use to stop the growth of fibroids also stop ovulation and menstruation. So a woman that's trying to get pregnant and is not ovulating, she's counterproductive. So we have to be very careful about that. So generally speaking, we have medical interventions and we have surgical interventions.
Just to wrap this up now, what are you going to build on? What advice would you give to people out there?
What I'm going to say to people, because as I said, fibroids are very common in this part of the world. 7 out of 10 black men have fibroids. Some will be small, some will be big, some will have symptoms, some will not have symptoms. Some may interfere with conception, some may not. But it's important to realize that if you think you have fibroids, see a doctor. He will conduct basic tests. He will guide you. He may not necessarily even say have surgery, because some of them are not having symptoms, and so we ignore them. So most fibroids that are symptomatic, that are small, we ignore. Okay? So, but if it's big or if it's having symptoms, usually we will say treatment should be offered. Usually surgical treatment or medical treatment. And let me also say, rounding up, that if you're talking about surgical treatment, the common of which we do in this part of the world is myomectomy. Fibroid surgery is very safe. Very, very, very safe. I tell people it's as safe as crossing the express. As long as you're not drunk and you look left, you look right, and you look left again, you should be able to cross that express safely. So the same way, as long as you choose a good center with someone that is experienced and everything is done properly, proper preparations are made, fibroid surgeries are very, very safe. That's the last word I want to drop our viewers this afternoon.
All right, thank you very much, Dr. Kolade, for this explicit session. We hope that whenever we call on you again for a session like this, you'll gladly honor us.
It will be my pleasure.
All right, see you guys.